Good afternoon, everyone, and welcome to today's update COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. Notre cheminement dans la pandémie de COVID-19 se poursuit depuis plusieurs mois déjà. La route était parfois accidentée et pleine de virages et il y a eu des moments où il était impossible de voir clairement ce qui s'en venait après la courbe. À d'autres moments, la route était sans encombre et droite pendant de nombreux kilomètres. We are now nearing the point where we can visualize an end to the road, even if we can't quite see it yet. But to reach that point, we must maintain a steady pace. We can't rush ahead or take shortcuts. We all need to keep doing what we have been doing for nearly 15 months, which is to follow public health guidance and advice so that we can all arrive safely at our destination. Nous ne pouvons pas précipiter les choses ni prendre des raccourcis. Nous devons tous continuer à faire ce que nous faisons depuis près de 15 mois. Suivre les consignes et les directives de santé publique afin de pouvoir arriver à destination en toute sécurité. While we continue to manage outbreaks and face the challenge of new and more contagious variants of the virus, there are encouraging signs around us. The most positive is the success of our vaccination campaign. À l'heure actuelle, près de 56% des citoyens du Nouveau-Brunswick ont reçu au moins une dose du vaccin contre la COVID-19. Ce pourcentage continuera d'augmenter avec l'expansion de la liste des personnes admissibles. Le taux de résidents ayant reçu leur première dose a dépassé 50% dans toutes les régions de la province, les zones de Miramichi et d'Edmundston ayant atteint le taux de 60% ou presque. So we now have close to 56% of New Brunswickers with at least one dose of COVID-19 vaccine. And this number will only continue to rise as we open eligibility further and we receive more and more supply. Every region of our province has now passed 50% with a first dose, with the Miramichi and Edmundston zones now at or near 60%. When we have provided a first dose to most of the population, we will move on to providing second doses. We have achieved a great deal, but there is still more to do. The risk from COVID-19 is being reduced, but it has not been eliminated. Now, more than ever, we all must ensure that we protect ourselves, our families, and our communities from this virus. Aujourd'hui, Santé publique confirme qu'il y a 9 nouveaux cas de COVID-19. Il y a 6 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. 3 de ces cas sont des contacts de cas déjà confirmés et les 3 autres sont directement liés à un voyage. Il y a 3 nouveaux cas dans la zone 3, soit la région de Fredericton et la vallée de la rivière Saint-Jean. Ces 3 cas sont des contacts de cas déjà confirmés. Il y a présentement 134 cas actifs de COVID-19, dont 10 citoyens du Nouveau-Brunswick qui ont contracté le virus ailleurs et 6 seuls à l'extérieur de la province. Il y a présentement 5 personnes du Nouveau-Brunswick infectées par la COVID-19 qui sont hospitalisées, dont une aux soins intensifs. L'une d'entre elles est hospitalisée dans une autre province. Today, Public Health has confirmed 9 cases of COVID-19. There are 6 new cases in Zone 1, which is Moncton and southeastern New Brunswick. 3 of these cases are contacts of previous cases, and 3 are directly related to travel. There are 3 new cases in Zone 3, which is Fredericton and the St. John River Valley, and these are all contacts of existing cases. We now have 134 active cases of COVID-19, and this includes 10 New Brunswickers who were infected elsewhere and are isolating outside of the province. There are now 5 New Brunswickers in hospital, including 1 in intensive care. This includes 1 person who was hospitalized in another province. In addition to these active cases and hospitalizations, we also have over 1,000 New Brunswickers who are currently self-isolating to help us limit the spread of COVID-19. I appreciate the hardships and the sacrifices that all these New Brunswickers are experiencing, and I ask you to keep all of them in your thoughts and your prayers. And as I stated, we are working hard to protect our most vulnerable residents. While vaccinations are helping, we must remain vigilant to prevent the spread of COVID-19 in seniors' homes and other long-term residential sites. Santé publique a déclaré aujourd'hui une éclosion à l'établissement Thibon Soins, un foyer de soins spéciaux à Shediac. Une personne qui travaille à cet établissement a récemment reçu un résultat positif à un test de dépistage de la COVID-19. Des membres de notre équipe provinciale de gestion rapide des éclosions sont sur place pour aider les membres du personnel à protéger les résidents qui sont tous en voie de subir un test de dépistage de la COVID-19. Today, Public Health has declared an outbreak at Thibon Soins, a special care home in Shediac. An employee at the facility recently tested positive for COVID-19. Our prompt team is on site to assist staff in protecting residents who are being tested for exposure to the virus. The situation in Zone 3 remains concerning, but we are working hard to contain the spread of the virus. And I just want to give a shout out to all the contact tracers all around the province who have been chipping in and helping out, doing all the contact tracing over the long weekend. It was so helpful and quite a team effort. To date, virtually all of the active cases in the Fredericton area can be conclusively linked to one another. The majority of those that are not linked are recent infections from out-of-province travel. With an ever-increasing number of people being vaccinated, we have seen less severe illness and hospitalizations that would put pressure on our healthcare system. We have issued many public exposure notifications because this helps limit the spread of the virus by letting people know about where they may have been exposed and allowing them to get tested whether they have symptoms or not. So if you have been in a place where an exposure has been reported, please seek testing, even if you've been vaccinated. To those of you who have come forward already, thank you very much. If you are directed to self-isolate because you are a close contact, please find a way to remove yourself from contact with your family. We do see transmission in household members, and we would love to avoid that. La zone 3 demeure à la phase d'alerte jaune, comme le reste de la province. Mais tous les citoyens doivent être conscients des risques et agir en conséquence. Vous n'avez pas à faire quelque chose de nouveau. Vous pouvez vous protéger et protéger les autres en suivant rigoureusement les consignes de la santé publique, les mêmes consignes que nous suivons tous depuis plus d'1 an. Sauf que j'ai entendu des traceurs de contact étroits, les infirmières de santé publique, qu'il y a encore des gens, quand ils font leur enquête, qu'ils ne portent pas leur masque comme il faut. Ça se peut qu'ils le portent, mais ils ne le portent pas par-dessus leur nez et par-dessus, au-dessus de leur bouche. Alors, faites sûr que vous le portez correctement. Zone 3 remains at the yellow alert level with the rest of the province, aware of the risks and act accordingly. This doesn't require you to do anything new. You can protect yourself and others by diligently following public health direction, the same direction we have been following the past year. And maybe you should be doing it slightly more so than you have been. Perhaps we've become a little bit less vigilant. So wear your mask properly over your nose and over your mouth, and make sure you do a lot of great hand washing. Be aware of your surroundings and be mindful of the risks that COVID-19 presents. And I did hear anecdotal evidence from people that they have been to establishments where they didn't feel particularly safe with respect to distancing, etc. You have the ability to go online and let us know about these types of situations, and we will have a public health inspector go and assess the situation. Please wear a mask when you're out in public and maintain 2 meters of physical distance from others. Wash your hands regularly and thoroughly. And between washings, make sure you use an alcohol-based hand sanitizer to remove any viruses that you may have picked up through contact. And we are getting closer to the end of the road, but we are not there yet. There is a way through this pandemic, and we are all tired from that journey, but we are eager to reach the end of the road. But we must stick to the route that we have taken so that we can all arrive safely at our destination. And I know some people have said, you know, even when we don't have to do all these measures, some people said they're going to continue anyway because they haven't had a cold for over a year. So that's encouraging in terms of what we've learned from COVID. Thank you very much.
Good afternoon. Bonjour. We continue to make incredible progress in rolling out our vaccine plan in New Brunswick. As of today, almost 56% of New Brunswickers have received at least their first dose of COVID-19 vaccine, and we expect to reach 60% by the end of this week. More than 60,500 people were vaccinated the week of May 16th, a record high for the vaccination campaign. While I know that many people have upcoming appointments, particularly people whose age cohort recently became eligible to date, currently 79% of New Brunswickers over the age of 50 have received at least one dose. And for those over the age of 60, that figure is almost 86%. On top of this, second dose clinics and long-term care homes across the province will be completed this week. While our progress is impressive, it is important to remember that the virus is not done with us just yet. Au cours de la fin de semaine, plusieurs cas ont été confirmés dans des écoles et des garderies de Fredericton. 2 cas ont été confirmés à la Priestman Street School. 2 cas ont été signalés à la garderie de YMCA de la rue York. Et un cas a été confirmé à la Connaught Street School. We ask families to be vigilant in following public health advice and to watch for more information as contact tracing is carried out. Outbreak management plans for schools have been developed by the Department of Education and Early Childhood Development with Public Health and WorkSafe NB to respond to confirmed positive cases in schools. Lorsque cas est confirmé dans une école, la santé publique évalue la situation au cas par cas. Notre objectif est toujours de réduire les risques pour les élèves et les emplois, de minimiser les répercussions sur l'apprentissage et d'appuyer la recherche de contact. I understand the rising number of active cases in Fredericton is concerning and has caused some to question why the area is still at the yellow alert level. As Dr. Russell has said, public health is keeping a close eye on the situation, and thanks to the hard work of the contact tracers, we have been able to connect the active cases to previous cases and travel cases. The combination of contact tracing and exposure notification with increased vaccination numbers is helping us to keep the Fredericton area in yellow. If the situation changes, we will not hesitate to act, but we will do so on the advice of public health. We are confident in the information that we have seen to date, and we're confident in the public continuing to adhere to public health measures. So we get through this period and we continue to vaccinate at record levels. We all need to think and continue to think how we can do things differently. As more and more New Brunswickers are vaccinated, the risk will diminish, which will result in less strain on our healthcare system. In the coming days and weeks, we will be asking for more assistance from employers. Employers will need to communicate when there are contacts of cases within their facilities. It's very important that all information flows freely so we can stay on top of the situation. This will indeed help public health in managing any risk. No longer will this just be the job of public health. It will be the responsibility of everyone to help control the spread of the virus as we learn to live with COVID-19. We are working hard to put together a plan that will allow the gradual easing of restrictions as we move along the road to the green alert level. We want to be in a position to move the entire province to green when the time comes. And I know everyone is anxious to hear more about our plan to open up, but we want to make sure that it is fully formed before we share details. Once we hit the path to green, we want to be able to keep moving forward and not have to take any steps backward. Nous avons réalisé beaucoup de progrès et je suis fier des efforts déployés dans notre province. We are one of the leaders in the country on our path to green. Understandably, there's a real sense of hope being felt across our entire province as more and more people get vaccinated. We have made tremendous progress, but it is important to remember that there is still continued work to do. Even if you have received your first dose or you are fully vaccinated, it is imperative that you continue to follow the guidelines for the yellow alert level. Everyone has an important role to play, and vaccines are indeed our path to green. Plus nous suivons les directives de la santé publique avec vigilance, plus tôt nous allons pouvoir alléger certaines restrictions. Je vous remercie de votre patience et de vos sacrifices. This pandemic has been challenging for us, but we are getting through this, and we will see summer in New Brunswick. Maybe a little different, but it'll be much more freedom than we currently have. But we need to stay focused. We need to have everyone get their vaccines when they're available to them. And the impressive work that continues to be done by healthcare workers all over this province in administering vaccine at increasingly high levels, only restricted by the number of vaccines that we have. Let's put this over the top. I'm convinced we will be successful, and we will see our province open up as we start the summer. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre. Dr. Russell, thank you, Premier. Thank you, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for Dr. Russell or Premier Higgs. Health Canada now recommends storing the Pfizer vaccine at fridge temperatures for up to 1 month. Does this change the vaccine rollout in any way? And are there currently any discussions about holding vaccine clinics at schools once the 12 and up age group is eligible?
Want me to take that? Hi, Vicki. So we are aware of that change, and as of right now, it's not changing how the rollout works at this point in time, but certainly that could evolve, and we're certainly having discussions between public health and EECD on how we're prepared to roll out the vaccination of the 12 to 15-year-olds. More to follow on that.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
Yes. Do children age 12 and up require parental consent to get the vaccine?
My understanding is yes.
Perfect. Thank you, Ms. Hogarth. Travis Fortnum, Global TV.
Hi there. My question is for Dr. Russell as well. We're hearing from parents and teachers who are concerned that as we get into the summer months, or summer weeks, I should say, that classrooms are going to be uncomfortably hot without the ability to use fans, and then wondering if you could speak to why they're not allowed to use fans. I know that you have in the past.
Well, anything that's to do with the schools and their operational plans would have been laid out last summer when Public Health worked with EECD on their operational plans. So everything that they're doing right now would be really related to that, moving forward even into the warmer weather.
Mr. Fortnum, do you have a follow-up?
Yes, and another thing that I know you've spoken about in the past, but the outbreak in the McGee residence at UND, there were concerns that ventilation could have attributed to that. I'm wondering if you could address that.
Well, I guess what I can say is once all the cases and the residents were self-isolating in their respective apartments, there was no further transmission. So whatever transmission occurred was probably in the common areas, like elevators, like front entrance, like hallways. But prior to all the cases and residents isolating in their respective apartments, there was transmission between people who either didn't know each other or lived on different floors, etc. But after they were self-isolating in their apartments, there was no further transmission.
Thank you, Mr. Fortnum. Thank you, Dr. Marie Sutherland, CBC.
Good afternoon. My question is for Dr. Russell. You said that you were going to look into the other recent COVID-19 deaths aside from the AstraZeneca-related deaths. Had any of those individuals been vaccinated, and which vaccine did they receive?
I believe we reported on one on Friday. Is that the one that you're referring to that would have been a vaccine-related death? And that would have been related to the AstraZeneca vaccine.
Can you clarify, Ms. Sutherland?
I'm wondering, aside from that one, have you looked at any other recent COVID-19 deaths aside from that one? And of those, had any of the individuals vaccinated, and with which vaccine?
Well, I'm not aware of any other deaths at this time, but we do have a process in place for all adverse events to be reported. We actually have a report that comes out every week, and we do have criteria to determine whether a death is related to a vaccine. So those processes are in place, and if there was any more information about a death related to a vaccine, we would report that.
Ms. Sutherland, do you have a follow-up?
I do, also for Dr. Russell. Both of the New Brunswickers who died after receiving the AstraZeneca vaccine were in the recommended above 55 age group. So what do you read into that, and have you detected any blood clot side effects in people under 55?
Well, certainly any of the evidence that we looked at globally, a lot of it came from the UK prior to seeing any adverse events here in New Brunswick with respect to vaccine-related thrombosis and thrombocytopenia. So I think we are aware that these things can happen in different age groups, but actually the first case here of VIT, vaccine-induced thrombocytopenia, thrombosis and thrombocytopenia happened actually in somebody under the age of 55.
Thank you, Ms. Sutherland. Laura Brown, CTV.
Hi there. 60% by week's end, that's a benchmark for some provinces elsewhere to loosen restrictions just a little bit. Can we expect any part of the reopening plan for New Brunswick by the end of the week?
We'll be continuing to work with public health as we roll out this week. 60% is a great threshold to reach. However, our target's 75% for the first vaccines, and the rollout plan that we will jointly put together and release will reflect us reaching, those targeted levels of 75%, and then first vaccine levels further, with the ultimate goal of going green. And so hopefully over the coming few days to a week, we'll be able to outline a path, and of course it's monitoring closely what we see right now and how well we're able to contain what we have in the Fredericton area and understand exactly where the issues are arising. And currently the health team have been very successful at doing that.
Ms. Brown, do you have a follow-up?
Yeah, I'm wondering if you can give us an update on the 3 current isolation hotels and if there's been any cases that have been linked back to any of those hotels.
Yeah, I don't know exactly. I think from the beginning, I can't really comment on that at this point.
Hi, Laura. There are actually 4 hotels in place right now, and I don't know of any cases that have transmitted from those hotels. That I don't. Again, my understanding is if there have been cases that occurred while people were self-isolating, I have not heard that any of them transmitted.
Thank you, Ms. Brown. Rachel Smith, Huddle Today.
Hi, I was wondering when you expect the vaccine will be available for those ages 12 to 15?
We are working on that with education and early childhood development, so we don't have the details on that right now, but we will be coming out with some details shortly.
Do you have a follow-up, Ms. Smith?
No, I don't.
Thank you. Derek Dubé, TVA.
Bonjour à tous. Ma question est pour le Premier ministre Blaine Higgs. Vous avez parlé la semaine dernière que vous n'êtes pas contre la fusion des régies de santé, Vitalité et Horizon. Est-ce que c'est toujours votre position, puisque M. Daniel Allain, le ministre Daniel Allain, a réitéré la semaine dernière, en fin de semaine, qu'il n'y aurait pas de fusion selon lui?
So what I said last week was that certainly all of I expected to see certainly a continuation of both networks as far as a Francophone network and an Anglophone network. What I reiterated is the need for us to get a common perspective on healthcare in New Brunswick, and we need to work jointly together. I don't know what form that needs to take, but I know that we can't be in competition with each other. If we're going to have the best healthcare system in this province, we need to find a way to work together and to achieve successes in each of the Francophone and Anglophone networks, but not necessarily in duplication, but in enhancement of either network in a particular field. So I'm excited about the frank discussions that are happening right now by healthcare professionals that realize that it is possible for us to have much better healthcare in our province, and we can achieve this together. Just as we've achieved success through COVID together, we can have a long-standing improvement in our healthcare services delivery, and we can achieve better results for every citizen in this province. And that's my goal. And I don't know what that looks like going forward, but that's my goal.
Tu suivi, M. Dubé?
Non, c'est tout. Merci.
Maud Montembeau, Radio-Canada.
Oui, bonjour. Hi, my question is for Mr. Higgs. Monsieur, cet hiver, vous avez dit que ça ne devrait pas être un problème de désigner des hôtels pour les Québécois qui se rendent aux îles de la Madeleine. Et il semble qu'à l'heure actuelle, il n'y a toujours pas d'hôtel désigné. Le Québec se déconfine et à l'approche de la reprise des déplacements interrégionaux au Québec et de la saison touristique, comptez-vous répondre aux demandes du Québec pour les Madelinots?
Well, I haven't had any recent discussions in that regard, but we have received applications or, I guess, requests from Quebec in relation to how that might work going forward. It will be a consideration, obviously, as we're looking at as we move on to be able to bring people back into our province who are property owners, family and relatives, and when we're able to do that, then it's reasonable to look at people traveling from Quebec to the Magdalen Islands and how we best can accommodate those requirements. So it obviously will be on the radar, and finding a safe way to see that they can get to their destination will be a priority for us too.
Et c'est déjà ce qu'il vous demandait cet hiver. Alors pourquoi ce n'est pas encore concrétisé au moment où on se parle, alors que cet hiver, vous disiez que ça pourrait se régler rapidement?
Well, as you know, we had situations, Quebec had situations in their outbreak. We did too in the northern part of the province, and that delayed any further discussion in that regard. We continue to see an easing of that. We've had the experience here in Fredericton over the last couple of weeks, but it isn't quite so pronounced, and we'd like to think that it is subsiding, and we will be able to accommodate other activities. But I say at this point, it all factors into our bigger picture of being able to reduce restrictions as we get more people vaccinated, so there's less risk of people traveling through our province. It also would be helpful if anyone that is doing that would also be at the level of vaccinations that we are seeking, so that we're kind of on common ground there. But the timing is now and through the summer to plan for that, and that's why it hasn't been able to be accomplished to this point.
Merci beaucoup, Maud. Merci, Maud.
Merci, bonne journée.
Before we go back, Dr. Russell has some follow-up information to Laura Brown's question.
Yeah, I'm not sure if you're still there, Laura, but we've identified 7 cases in total in isolation hotels. My understanding is there was only one that transmitted, and that was the one at the Delta. The Delta isn't actually an isolation hotel any longer.
Perfect. Ms. McKinnon, Bobby Jean, CBC.
Yes, thank you. Dr. Russell, you say that the vaccination levels have helped keep the Fredericton region at the yellow level, but the COVID alert levels indicate that one of the possible triggers for a lockdown is at least 4 of certain sectors being affected. And it seems we have that now with acute care. There's the Chalmers daycares, we have the Y schools, there are cases at 6 now, I believe, and workplaces, there's the Delta and the Hilton that we know of, plus numerous other possible public exposures. So
Are you looking to revise the levels, or can you just explain a bit more on this, please?
Sure. So you are correct in that we do have triggers that trigger a risk assessment. The triggers are not for a lockdown or a phase change. They're for a risk assessment about recommendations about whether or not we should change phases or go to lockdown. And at this moment in time, our triggers on the epidemiological side, yes, we have rising case numbers, but they aren't exceeding our ability to contact trace. They aren't exceeding our ability to test. So our capacity is great. We're testing about 400 people a day here in Fredericton. And one of the big ones is public compliance with public health measures. We are seeing people complying and cooperating. And then we're also always very, very aware of the risk for overwhelming the healthcare system. And the DEC outbreak has actually currently been declared over. For right now, their bed capacity in ICUs, in the ICU, et cetera, is good. They do have challenges with capacity with respect to healthcare workers needed to self-isolate right now, but again, we're keeping a really close eye on that. So you have great points in terms of why are we in yellow when all of these different areas are affected. And I guess what I can say is that as of right now, all of the things that everybody's doing collectively is actually helping to keep us in yellow. So we need to keep doing that and just be very aware that, again, if things were to look more serious and severe in terms of the consequences of having the healthcare system become overwhelmed, et cetera, or have community transmission, we definitely would react.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. Again, for Dr. Russell, you told CBC this morning that the only cases in the Fredericton region that aren't linked to the original cluster at the Delta are new travel-related cases. Can you tell us how many of the active cases are travel-related, and has the origin of the Delta cluster been determined?
We knew that the case, I'm not sure how many cases were related to the Hilton, but that was a direct transmission from the Delta. So in terms of the original cases linked directly to the Delta, I think there were around 10. And then most of the active cases are contacts of that, those particular cases. Separate from that, the travel-related cases in the last few weeks, I'm looking for the total right now. We have 12 active cases in Zone 3 that are travel-related.
Thank you, Ms. McKinnon. Savannah Ott, Telegraph Journal.
Hi there. Given that we're in yellow and travel and gatherings were allowed over the long weekend, are either of you concerned about a spike in cases a few weeks from now? And could the Premier speak to whether there was any increase to public safety checks over the long weekend?
I'll start and then the Premier can finish. So as with any long weekend, and I think Minister Shepherd spoke to this on Friday, as with any long weekend, there are always risks of having spikes afterwards. We saw that at Christmas and New Year's, et cetera. So definitely it's on our minds that we could see a spike. There's no question. So we will definitely watch for that. And if you have mild symptoms, please get tested, even if you have been vaccinated. And if you've been to one of the public notification areas or sites, then please also get tested and have a very low threshold for doing so.
I think, obviously it's correct on a long weekend, and especially the first long weekend that is attributed to starting the summer activities in New Brunswick. There is a risk, but I think that people are, not only we have a high vaccination rate, much more so than previously, but people have an awareness, and I think they're cognizant of the need to follow that. The surveillance was increased but as we talked about it over the weekend and certainly on last Friday, the level of compliance has been good. Yes, we've had some exceptions, but the level of compliance is generally good. Certainly, that's a great sign that we are focused on the end game, and people in New Brunswick have to date, for the most part, certainly shown that adherence that has got us this far. And I don't think they're going to let us down now. I think that everyone realizes that we're so close that they just need to continue to do their part. and doing their part is recognizing, how they act to follow public health rules, but the fact that they get vaccinated when the opportunity arises.
Thank you both. Ms. Odd, do you have a follow-up?
Yes, I do. Thank you, Bruce. This one's for Dr. Russell. Can you tell me what groups are currently getting their second dose? I know long-term care homes are in that category. Are there any other particular groups included there? And do you have a total, I guess, for how many have had their second dose?
My understanding is that we do have second dose clinics that are remaining in 13 long-term care facilities in zones 1, 2, and 3. And that's the information I have on the second doses. So you are right, we are getting through the long-term care facilities first with respect to those second doses.
Thank you, Ms. Odd. Tim Roselle, Global TV.
Hi there. My first question is for Dr. Russell. Just wondering, Dr. Russell, if you could expand on a question that came earlier about how a fan can contribute to the spread of the virus.
Well, I didn't directly comment on that. I really just spoke to the fact that anything that's contained in the public health advice that was provided to education and early childhood development for their operational plan was done last summer, and that's what they've been implementing throughout this school year.
Mr. Roselle, do you have a follow-up today?
Yes, please, for Premier Higgs. Premier Higgs, just when you were speaking about the eventualities of opening up and the different thresholds that the province needs to meet, are those thresholds primarily tied to percentages of New Brunswickers who get that first vaccine, or is it case counts? Is it a combination of both with other factors? How is it all going to kind of shake out?
Well, certainly the percentage being vaccinated, it would be a key threshold, and that will be part of this. And then the second vaccine is certainly another part as you move through it. And if any point in time there would be a serious outbreak or concern, that would be a delay factor. And that's why as we roll out vaccines and we see such tremendous progress in that regard, and even in the younger ages, I mean, we're at 35% even in the age 30 to 39. So in 20 to 29, we're 25%. So with those kind of, and that's only been offered for a short while now. So that is key. The vaccination levels are key to our ability to open up in phases. And so I say job one is getting vaccinated. And then from that point on, it would be if something unforeseen happens that would cause us to delay. But right now, at this point in time, the best thing people can do is certainly get vaccinated and continue to be diligent about the health rules, and let's get summer in New Brunswick.
Thank you, Premier. Thank you, Mr. Roselle. Before we proceed, Doctor has a follow-up to Bobby Jean McKinnon's question about the Delta.
So I don't know if Bobby Jean is still there, but we actually have a total of 12 cases that were directly related to the Delta, whether they were patrons or staff. And then there were 54 contacts, either direct or indirect, from that. So a total of 66 related to the cluster from the Delta.
Thank you, Doctor. Andrew Watt, Brunswick News.
Yeah, my question's for the Premier. Premier, I want to go back to your opening comments there. You were talking about how in the coming weeks employers are going to have to ensure information about contact tracing flows freely. Can you expand on those comments, and have you been having problems with this today?
Any difficulty that our contact tracers have had have been related to the difficulty to get all of the information when it's needed, or someone to think that it's irrelevant, like it really wasn't a big issue, so it's not important. You know, I guess what we're saying is encouraging employers, encouraging individuals to be very forthcoming. That is the key. And the more the contact tracers are able to do a series of connections, and certainly right now there's a lot of connections being made, but they're connections of connections or contacts of contacts. So there's a lot of extra work being done to go deeper into the chain, which has helped get a better understanding. So a lot of people are working really hard to make sure that they don't miss a particular contact. And the degree of success and accuracy has allowed us to make better decisions and to keep open longer and to keep people moving forward as we move to green. So we don't want to regress. We want to keep moving forward. And that's why I just emphasize, don't take anything for granted that, I wasn't there long enough. I really didn't have any exposure. It doesn't hurt to just say, yes, this was where it was. Yes, this is what happened. Just be very, very forthright, even if you think it's irrelevant, because it really helps the people that are advising us on what the right next steps are.
Thank you. Mr. Waugh, do you have a follow-up?
I do, again for the Premier. So, Premier, Dr. Russell just said there's now 4 COVID isolation hotels. I would like to, I know the other 3 are in Fredericton, St. John, and Moncton. Like to know where the 4th is. And given the number of cases that the doctor just mentioned, any regrets about instituting that program?
Well, at this point in time, given our case count and the fact that we've been able to contain the virus, I would say no, there hasn't been any regrets. Yes, we had that problem in the Delta, and that's been dealt with. But I think the true measurement at the end of the day is the control of the spread and the ultimate outcome as it all. We can all go back and think of would we've done it differently or not, but as I say, we measure it was like being asked a week or so ago about the number of tests. And I said, well, we're measured in the number of cases and how accurate the case counts are in relation to the contacts and what we expect. And what's been really impressive has been how, we'll get an update of new active cases and then so often it's like, well, yes, we expected it. We're kind of on day 8, 9, or 10. And so it's really kind of shows the accuracy and the capability to date. As regards to the 4th hotel, it's in the Northwest, and that was just kind of having it regionally spread out so people wouldn't be too far away from where they might be headed.
Dr. Russell would like to add a point.
Hi, Andrew. I just wanted to add that with respect to cases at isolation hotels, we do expect there to be cases at isolation hotels because people are self-isolating for a period of time. And if they do become positive, the whole point is to not have them transmit. And certainly when all is said and done, after we no longer need self-isolation hotels, we can definitely compare the rate of transmission pre-self-isolation hotels and the transmission after self-isolation hotels were implemented. And we're making the assumption that we'll see a definite improvement in terms of, before and after.
Thank you, Mr. Waugh. Before we go on, Dr. Russell has a point to raise to Savannah Odd's question.
So 97.4% of all long-term care facilities have now had their second doses.
Sophie des Hôtels, Radio-Canada.
Oui, bonjour. Ma question est pour le Dr. Russell. Pour atteindre 75% de la population vaccinée, évidemment, il faut inclure le plus de gens possible. Je sais que vous avez dit que vous planifiez d'ouvrir la vaccination aux 12-18 ans et que vous êtes en train d'organiser cette vaccination. Pourriez-vous nous donner un peu plus de détails de ce qui est difficile pour organiser cette vaccination pour ce groupe d'âge? Est-ce que c'est parce qu'il faut sortir les élèves des écoles ou on ferait la vaccination à l'école? Qu'est-ce qui est différent?
Alors, je sais que les discussions ont eu lieu entre le département de santé publique et le département d'éducation pour les différentes options, les différentes possibilités pour faire la vaccination de cette population. Et on aura d'autres détails sur les résultats de ces discussions sous peu.
Mademoiselle des Hôtels, as-tu un suivi?
Donc, vous ne pouvez pas rien dire de plus là-dessus, ça?
On a discuté toutes les possibilités et les choses qui diraient oui ou non, c'est possible ou non, mais j'ai pas des détails sur les résultats de les discussions. Oui, c'est vrai que avant l'annonce d'être capable de transporter ou réfrigérer les doses à une certaine température, ça c'était une limitation, mais aussi les logistiques pour les ressources humaines, les logistiques pour les familles, les parents, etc. Alors, toutes ces choses ont été discutées et on aura des résultats pour partager avec vous dans les prochains jours.
Ça marche, Sophie?
Oui. En fait, ma deuxième question, c'était sur le foyer. Est-ce que vous êtes inquiet d'une possible éclosion là, cardiaque dans le foyer au bon soin?
Toujours les éclosions dans les foyers de soins, les résidences à long terme sont très concernants. Ça nous inquiète beaucoup parce que c'est des populations très vulnérables. Mais aussi les staffs, les travailleurs de santé, les employés aussi sont vulnérables s'ils ne sont pas été vaccinés encore. Alors c'est pour ça qu'on voulait que la population qui travaille dans les résidences à long terme et les foyers de soins soient vaccinés eux aussi pour leur protéger contre les éclosions. Quand même, si c'était un staff ou un résident ou un visiteur qui l'amène aux résidences, toute la population, soit résidents, soit employés, sont toutes vulnérables à des infections, dépendant sur leur vaccination, s'ils ont une dose ou deux.
Merci beaucoup, vous deux. Adam Bowie, Daily Gleaner.
Hi, this is a question for either Dr. Russell or the Premier. Public Health England released a study over the weekend that showed first doses of the vaccine offer only about 30% protection from the B.1.617 variant. Given that that variant is known to be circulating in the Fredericton area, and we know our current rates of vaccinations, really largely first dose only or no dose at all yet, I wondered if that's cause for concern for potential spread and are you worried about the potential that could cause?
Hi, Adam. I did read that same article. I do not remember if it said which clade. There are 3 different clades of the India variant, 1617. We're the second one of that variant. And right now, again, we're very confident that as we move through our vaccination program, that we're going to have, higher and higher rates of protection. And it's just one thing in our toolbox. So we know that vaccines are going to be more and more important as people get their second dose and increase that level of protection. And certainly in the meantime, that's why we're not releasing a lot of public health measures in terms of, staying the course at this moment in time, because regardless of the variant, whether it's the UK or whether it's B.1.1.7, whether it's B.1.617, or whether any of the other ones, we really have to, again, continue to protect our population against severe outcomes, hospitalization, and ICU admissions. So again, we're just going to keep doing what we're doing. We'll keep following the data and using that data to inform our decisions, and that's all we can do.
Thank you, Dr. Mr. Bowie. Do you have a follow-up?
I do. With the 6th Fredericton area school reporting cases of COVID-19 and some parents feeling a bit nervous about sending their kids to school, I wondered if you had a message for them and if you're still confident that keeping schools open is the right move.
Well, I'm a parent. So I can definitely relate to anxiety around sending your kids to school during a pandemic. There's no question. And certainly it hits close to home when it's in our city. And I think, again, I feel confident in the sense that, I speak with the contact tracers, I speak with the managers in public health. EECD representatives are on our in-briefs and out-briefs every day. We work really closely with communications. Anything we can do to help parents and students and staff understand the situation, we try to communicate that. As you know, sometimes there is a case linked to a school, but there hasn't been an exposure at the school and there hasn't been transmission within the school. So we take all of these things into account, and again, we do try to communicate that to those people that we know are very, very close contacts in the same classroom, et cetera. And we actually treat those students and staff differently than the wider school population. And once the inner circle of close contacts is tested, and we continue to, have them self-isolate and then do a day 10 test, then again, that approach has been working for us. And really and truly, we saw the India variant, how it affected George Street Middle School and how we got that outbreak under control in terms of the contact tracing, et cetera. So we're going to keep using that approach. We did learn a lot from that particular experience, and we'll keep building on that with each and every case that's connected to a school.
Thank you. Thank you both. Thank you, Mr. Bowie. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you.